Start.
This female little girl, age around 3 years 7 months, like this patient is suffering from fever for the last 5 days. Initially there is fever with nausea and little vomiting, but at that time she was treated by local physician, and there was some respiratory medicine was given, and along with some painkiller is also given for the local treatment. So then the patient little bit improved, and the medication was not appropriate as I have seen later on. The patient was visited to the outside for some religious purposes, but there suddenly she developed rectal bleeding and also pain in the upper abdomen with intense nausea and vomiting. And patient is not unable to eat or feed anything. This is a very negative issue. So the anxious parents they rushed to my clinic for the last 4 to 5 days before, 3 days before I think, 3 days before. So the chief complaint is at that time intense pain in upper abdomen and intense nausea, and also the tongue totally was sticked in the mouth, and there is the extensive mouth ulcers, and throat is also eroded, and the patient unable to take any food or something. This is the very critical outcome, and patient very in emergent condition come to my chamber. Now I am come into the treatment part. The patient at that time require urgent admission. The little patient, I am not routinely at this age, I am not going to admit the patient because this is a pediatric case, definitely. But as there is a GI upset is pronounced, in that case there is extensive GI upset. Patient is suffering from nausea and also unable to feed everything. There is a dehydration is also the severe dehydration. So at that time I decided the patient should get admitted under my care. The one thing I want to clarify in this situation, here the patient, the problem is going in the local treatment. So they are giving some medications. I am not going to detail in the, I am giving you the just composition. The patient is eating acetylphenone syrup. She has received at this age of 3 years ofloxacin ornithazole combination and repeated painkiller by syrup form, and also some anti-allergen medications also there. So this is a very dead effect of the intestine. The intestine is a very structure which should not be exposed to like this medicine, because patient is not going to take the any antibiotic, not going to take the any painkiller. She may be recovered with the time being. Ultimately, she has come with this severe acute condition. Then she was admitted and the thorough investigation was done. Ultimately, diagnosis was confirmed that the patient is an acute bacterial infection, and followed by the receiving of these medicines, it caused the intense GI upset. That is the intense mucosal laceration from the mouth to anus. For this reason, the rectal bleeding was started. Patient was suffering from rectal bleeding and unable to take any food, including water. She doesn't take any water intake. An intense pain, the tongue doesn't come out. So this is the very dead outcome of this treatment of the local. So I have examined the patient and the investigation was done. Ultimately diagnosis confirmed, and patient was on the piperacin, tazobactam antibiotics, and also the co-amoxicillin injections, and along with the patient the complete GI cover-up with the rifaximin, with the prebiotics, with the ready bacterial flora, and patient is observed meticulously, and with the help of our team in the Rameshwaram nursing home, the all sisters and all the co-staffs are going to take their proper roles to manage the patient and their clinical activity, and also patient with the good nursing care. Today now she was absolutely okay. Now show your tongue little bit. The patient now is very good condition, and they showing her tongue is good, and See, today morning or last from evening onward, she has taken the food also, and with the less pain, and there is no GI upset. Now I think stool was come as early, and now she was discharged in good condition. And this is the ultimate conclusion. They will give you the antibiotics, will give you the painkiller in this little age, or by the local doctors or local physician. They should take care the total GI part. Otherwise, there are massive GI ulceration and there are massive damage of the GI tract, and they may cause the acute condition of the patient and the acute dehydration also. Thank you so much.